So I have a Reddit community called Microdiscectomy. I'm also in the Facebook Microdiscectomy community. So will watch the podcast, but oftentimes I'm talking to people who just had it done like 8 months ago, and they keep asking me, we need long-term success stories. So you would be considered an amazing long-term success story.
I am so glad. And I never thought this day would come. And that's why I stay on the group, because sometimes like I'm on the group and I'm like, do I really need to be here anymore? I'm not suffering. But then I remember there's so many people out there that are suffering. And if I can give them a tiny bit of hope that I didn't have back then.
Right, exactly.
That's a good reason for me to stay on the group.
Before we get into today's episode, I do want to let you know that we briefly touch on eating disorders, and we also talk about mental health and suicidal thinking.
Welcome to Bed, Back, and Beyond, sharing positive stories of recovery from serious back or neck injury. Your host is CK, a fellow champion who draws on her own experience with herniated disc surgery. Join her as she talks with others who have overcome the physical and emotional trauma of a painful injury, and discover for yourself how you can find hope and encouragement in recovery.
Hi, Susan. Thank you so much for joining me on this episode of Bed, Back, and Beyond. Before we dive into your injury, how about you tell us a little bit about yourself?
Well, thanks so much for having me. I'm so excited to be here. So a little bit about myself. I'm 40. I live in Nova Scotia, Canada. I work in healthcare. I do mostly advanced care planning with COPD patients. I do some social worky stuff as well, even though I'm not actually a social worker. Some of my hobbies are like, I love to read. I'm obsessed with reading. I do it all the time. A lot of my hobbies are different post-surgery than pre-surgery. And what I like to do now is I like going kayaking and hiking and swimming and doing all that kind of fun stuff, just being outside in nature. That's my happy place.
I'm going to try not to derail the conversation about reading. Like, what are your favorite kind of books?
So I have just I went to university for 12 years. And I forgot that you can read for fun.
Yes.
So I had stopped reading for so long, and I just got back into it again a few months ago. And I'm obsessed with fantasy and fantasy romance. Yep.
Do you have one book in particular that's your favorite?
Right now, I'm really into the A Court of Thorns and Roses series. So I'm halfway through it. I got 2 books left.
I haven't read any of those. I see them on TikTok all the time.
That's where I got it. Yeah.
Yeah. Now, my listeners are probably tired of hearing this, but my husband and I just celebrated our 20th wedding anniversary, and we went to Banff National Park.
Yeah.
And I know that's on the total opposite side of Nova Scotia.
It is, but I hear it's beautiful.
Oh, it was gorgeous. But on my bucket list is St. John, Labrador. Is that near Nova Scotia?
It's St. John's in Newfoundland and Labrador. It's technically not in Labrador. It's in Newfoundland, but it's in the province called Newfoundland and Labrador.
Okay.
But we're going to Newfoundland in June. We will not see St. John's because we're going like the ferry. We're taking the ferry and it goes on the other side of the province. But St. John's, I hear, is gorgeous. So you will love it.
So because what people tune in for is your back injury.
Yes.
Instead of our interests, right? So did you always have a back problem, or did you one day just get hit with a back injury?
Oh, it happened so suddenly, it seemed. So like I went through a weight loss journey back in 2018 and I lost like 100 pounds. And you would think after losing 100 pounds, you would feel better. And I started feeling worse. And I got this pain in the back of my leg is where I noticed it on my upper leg. And I thought it felt in the beginning like a pulled muscle. And they were telling me, oh, it's your hamstring. It's like they were giving me all these kind of excuses of what it could be. And I went to a physiotherapist for this hamstring, whatever he called it. And she said, that's not what's wrong with you. And I said, well, that's what the doctor says. And she said, well, if that was wrong with you, this would hurt really bad. And she pushed into a part on my butt. And it didn't hurt. And she said, see, that's not what's wrong with you. And she said, it's your back. And I was like, that sounds insane because it's my leg. And I didn't know how it all worked at the time. So I went in for that was around September, and they finally got me in for an MRI, and they realized that that's what it was. It was a back injury. So it built up, like it felt like it hit me suddenly, but it built up like where I was thinking it was just a muscle problem in the beginning.
Okay. What were you doing something different for the weight loss? Just cardio, or were you doing weight lifting?
So when I lost all the weight, I actually had an eating disorder, and I was, so that could have actually triggered my back problem because I was purging a lot.
Yes. Okay.
Mm-hmm.
Wow. Well, thank you for sharing that.
Yeah.
So then I've heard in Canada that the medical system sometimes makes you wait a long time. Were you able to get your MRI very quickly?
It took me a couple months to get the MRI, and I believe I had it. I can't remember when I had the MRI, but I got in February of 2019 to see the surgeon, and I would have had the MRI probably in November of 2018. By the time I got in to see the surgeon, it was less than a year before I had my surgery. So some people I know, they've been on the wait list here for years. That wasn't my experience. I was sore for a year, 14 months, something like that.
And when the surgeon saw the MRI, did he say, yep, surgery right away? Or did you have to do physical therapy first?
So here, like, your general practitioner has to refer you to a surgeon. He wasn't referring me to anybody until like I had to do physio. I had to do, I guess I didn't have to do, but like we tried medications, like very, very heavy narcotics I was on for quite a while. I went through the pain clinic, and that actually had a 5-year wait list. And because I knew them, they skipped me ahead. So like I did that kind of guiltily, but I was in so much pain that I was desperate. So I did that. And by the time I got to the neurosurgeon, I had just told, like, my doctor said, you're too young. They're not going to do it. You're not a candidate. And I'm like, I don't care what you say. Let him tell me that, or her tell me that.
Yeah.
And I said, just put my name through and then they can reject me. And so he said, whatever. And he put me through. And immediately when he saw me, he did a couple maneuvers in his office or whatever. And he said, you're a perfect candidate. Immediately he accepted me and put me on the wait list for the surgery.
And do you happen to know the millimeter measurement of your herniation?
Oh, what did they remove? 4, maybe?
Okay.
It wasn't I don't think it was a big one, but it was small but mighty. It did a job on me.
Yeah, I always say I see people post their MRIs online, and some of them these huge bulbous things pushing into the spine, and mine looked like a little thumbprint. I'm like, what?
Yep. Mine was small when I asked it after the surgery. When I woke up, I was like, how much did you take out? And they're like, not much.
Yeah.
But it was enough to do. And I will say, I do have a lot of sensory issues and stuff like that. And I have a very low pain tolerance. So maybe my situation wouldn't have hurt as much for some people, but I'm not some people on me, and it hurt for me. So
right. You have to judge based on you. It's really hard not to compare yourself to other people.
Yeah, it is.
Especially on the forums. Now, you said it started in your leg. Was it just in your hamstring, or did it go all the way down?
By the time, it didn't take long, like it started in my back where the hamstring is, but it didn't take long for it to affect my entire leg. Like I had the drop foot and everything like that. So it was affecting everything in that leg by the time they did the surgery.
No, like urinary retention or anything like that, though, like the red flags. No. So you said you saw a neurosurgeon, right?
Yes.
Yeah. Was that based on what the doctor referred you to, or did you have the option between neuro versus ortho?
I didn't really have an option. I don't recall. I mean, it's been a while. I don't recall having an option, but I think he just put me through to a neurosurgeon. But once I started talking to people on the forums, I'm sure they both could have done a good job, but I really was happy to have a neurosurgeon who's familiar with all those nerves and stuff in there. And yeah.
So how old would you have been during the injury?
So 2018, I would have been 34. And by the time I had the surgery, I was 35.
It's nice to hear them say you're too young, isn't it? Like
I know. I love it.
I think I was 40 or 41 in 2019. There was a young man in my church who had gotten surgery the year before, and he was 20 something. So I kept saying, look, the 20-year-olds get it too. It's not just because
I
I'm
know.
40.
And I see on the forums all the time, like people saying their 17-year-old is going in for surgery.
Yes.
And I'm like, why did they think I was too young? Like,
Yeah.
I don't know.
Let's see, I went to the emergency room and they didn't even do an MRI in the emergency room. They said, they didn't give me narcotics. They just gave me prednisone, like a steroid.
Mhm.
So like a 3-day high dose. And then they said, go see a back pain specialist. And that took me 2 weeks to get into him. And he did all the stand up on your toes really fast, lay on your
Mhm.
back, let me lift your leg. And of course, I'm
Mhm.
like, ouch. And he's the one who ordered an MRI. So it still was like another 2 weeks before I could get the MRI.
Wow.
And then we went, did you try a cortisone injection at all?
I think it was a cortisone injection. So basically what it ended up being was, he would give me an injection almost right by my tailbone because it was a lower, it was L5S1 and it was really low where he went in. And he did it about every 6 weeks until I had my surgery. And I know you're only supposed to get it like, how many
3
times a
times.
year?
Yeah.
Yeah, 3 times. I think I got it 5 or 6, but if he hadn't done it for me,
Yeah.
I would not have survived for my surgery because I was like literally at that time I was suicidal because of the pain. I couldn't take
Yeah.
it.
Was it X-ray guided or was it just the localized cortisone?
It was I believe he used an ultrasound machine.
I had one of those and it worked for a couple days. They numb you first, so that always feels great. And then it wore off. And then like 2 weeks later, I tripped going up to the steps. I didn't fall, but I kicked
Oh
my bad leg
no.
out. And it just brought my
Oh,
pain right back
oh,
to like normal
that's
level.
awful.
Yeah. So then I was like, I'm getting surgery.
Yeah, yeah. And really I knew this was kind of tiding me over until I could get the surgery
Yeah.
because as soon as they agreed to give me the surgery, I'm like, yeah, I'm doing it because the shots would like the first one lasted maybe like 8 weeks, then the next one lasted 7 weeks, then 6 weeks. So it wasn't as effective as I went on.
Right.
And I know like if I was still having to get them now, that probably wouldn't be working.
So that was something I knew about cortisone injections was that you can only get so many in your lifetime before they become less effective for you. And I was thinking, well, I'm 40. I don't want to, use up my reserve now before I even hit like 65 or 70.
Good
Who knows
point.
what else I'll need it for?
Yeah, I didn't know that actually.
Yeah.
Like that. Yeah, I didn't know it had like a lifetime limit. That's interesting.
At least that's what
Hopefully
I've
I
heard.
didn't go through mine yet.
So did you have any reservations about surgery or were you like, just get me under the knife?
They tried like with the whole, they gave me the statistics, 5% come out worse, 15%, nothing's wrong.
Yes.
And that kind of thing. They tried to talk. I was terrified to go into surgery, by the way. Like I was terrified, but I was so desperate that I would have done anything. I was in the hospital I was living in another province at the time. Like I had moved there. I only lived there for 14 months. I was in the hospital there and I literally begged them to drive me to the hospital in Nova Scotia where I was living, and that's where my referral was, to not miss my surgery. And they ended up discharging me like a day before my surgery. So I was able to go, but like I was absolutely desperate to get it.
Were you able to work at all or were you strictly homebound during all this?
So that's interesting. So when it first started and I was living in Nova Scotia, I had a job. I was working, at a non-for-profit youth homeless organization. I ended up having to, I had to get rid of my car, because I couldn't get in my car anymore. And they had a van, that they lent me my work. They had, this huge van that they lent me until I could get my SUV. I ended up every single day because I couldn't sit for long. I couldn't lay down for long. In fact, I had to wake myself up every half an hour throughout the night or else I couldn't get up in the morning. So I had the only thing that I could do was stand. So I ended up going down to this cafe at the bottom of the street. I would take my work computer and work from there. And I would stand there for 8 hours a day at their tall table that they had. And I would just stay there every single day. Then I got another job in the neighboring province of New Brunswick, and I went there. And I was working in healthcare in the hospital. And at that time I had my injection, so I was doing okay. But then I got sick with something else. Like I had some mental health issues and I ended up in the hospital. So that was an interesting turnaround. So I wasn't working at that point, but it wasn't because of my back.
So you mentioned that you were suicidal before waiting for the surgery. Did you reach out for any kind of mental health help, or how did you help yourself with that?
I cannot say enough about how horrible the mental health system is in this province. It is something that they need to work on. And it's been like, I've had mental health issues and I've been struggling since I was 3 and they haven't done anything for me. So when I went with this, the worst part was one night I went to the hospital with a bag of pills and I had every intention of using them.
Wow.
And they told me that they would deal with my body out in the parking lot when I was done. They had no idea how to help me. They had no idea. They sent me away every single time. So I am still alive today, not because of the mental health system here. It's awful. Yeah.
Did you have family support around you?
I had my dad was sick at the time. My family is supportive as much as they can be.
Yeah.
But where my dad was sick, my mom was kind of focused on that. Actually, the person that saved my life that night was my pastor came and he took me back to his house with him and his wife. And I stayed with them for like a week or 2. I can't even remember how long. Until I was able to be safe enough to leave.
I'm glad that was a safe spot for you.
Yeah, me too.
Yeah.
I wouldn't be alive. I 100% believe I wouldn't be alive if he hadn't been there that night.
Yeah. I don't think people realize, people who haven't herniated a disc have no idea how debilitating the pain is.
No, nobody understands.
No.
Nobody gets it unless they've lived with it.
Yeah. And when your back is infected, you can't do it. It affects your entire life. Yeah. It does definitely can lead to a very dark time. I'm so thankful that you had that support.
Yeah, me too. Me too. And I had some really lovely friends around that time. And when I look back, I'm like, I'll still say to them sometimes, like, I'm so thankful that you stuck with me because it was a dark time and I was bringing people into a very dark place.
Yeah.
And the fact that they stuck by me through that speaks volumes.
I didn't recognize myself, I think, for a year after the surgery. It took a year to recover emotionally from it.
Absolutely. Yeah. Absolutely. And I was terrified of my own body after the surgery.
Right.
And it took me 8 weeks to lose the pain after the surgery. Like I didn't think the surgery worked at first.
Right.
And so once the pain subsided, I was terrified of myself. I was terrified of doing anything, thinking I was going to re-trigger it. Now I'll do anything almost, but within reason. But I don't always have that fear, but I'll still like, if I feel a twinge in the back, I still like, is this happening again?
Yeah.
So it's like, it does take a long time to recover from it.
Yes. Your surgery, was it in and out same day or did you have to stay a couple nights?
Yeah, it was in and out that day. Like I went in the morning and I didn't wake up at I don't think they were worried, but I didn't wake up as quick as they thought. So I went in for the surgery at like 9 o'clock and I left that night at around 7. I lived 3 hours away from the hospital. So I stayed with a friend overnight and the next morning I was on my way back.
Somebody drove you home? You didn't drive yourself, right?
No, I didn't drive myself. Somebody drove my car and yeah.
Did you just recline back on the drive home? or did you
I
sit?
reclined back
Yeah,
heavily, and I was heavily medicated on the way home. I was sleeping, and
yeah. So my surgery was supposed to be in and out the same day,
Mhm.
and I think they had told my husband 45 minutes to an hour. And then when they went in, they found that my disc was actually glued to the spinal cord with
Oh
scar
my
tissue.
yes.
So it took much longer, and they didn't get it all. So I still have like a chunk of the herniated disc on my nerves, just kind of sitting
Oh
there still.
yes.
But my husband, was sitting in the patient family waiting room
Mhm.
watching other people come and go, and the doctors come, oh, they went, fine, you can leave. And then my doctor finally came out. I forget, I think it might have been 3 hours, if I remember. And my husband is a
Mhm.
pastor, so he has experience with waiting with people at the hospital.
Mhm.
So my doctor came up to him and says, can we go into the conference room? And my husband said his vision went into tunnel vision, because he's like, I knew what that meant.
Yep.
So I feel so bad for him when I think about it. But I took a long time to wake up from anesthesia. So they were like, she's not waking up. She's fine. And yeah, but I always feel guilty for my poor husband.
So did you end up staying overnight?
I had to stay for 3 nights.
3 nights, yeah.
Yeah, because there was a tear in the door. So I was leaking the spinal fluid. So they
Mhm.
did a blood patch. And so I had to lay on my back flat for 3 nights. I wasn't allowed to get up.
Oh,
And
oh.
then so it was Wednesday, and then on Saturday, they had to like slowly raise my bed every hour until I could finally sit up straight.
Oh my gosh, what
Yeah,
a process.
it was. Yeah. And they had to put a catheter in. I don't know if I mentioned that before. That was not fun.
No, I've
No.
had many a patient. I was a chaplain when I worked in the
Okay.
hospital, and
Yeah.
I've been next to many beds with catheters, and they are not fun as
No,
far as I
no.
can tell. No.
So you got home okay without a problem. That's great. So were you
Mhm.
home alone, or did you have somebody staying with you during your recovery?
No, I was by myself.
Okay.
And yeah, like nobody, when I moved to New Brunswick, nobody lived there.
Mm,
All of my friends and my family were back in Nova Scotia. So once they got me home, they ended up leaving, and people checked in on me, but like by phone. But yeah, I was by myself, just me and my 4 at the time kitties. And yeah, so I mean, even that, like, I was taking care of them.
right.
So it was like,
And I'm sure
it
did you have the no bending, lifting, and twisting restrictions?
did I follow it, as much as I could, but I
Yeah.
still had to dig out the cat litter and stuff like
Yeah.
that, so, yeah.
So what kind of things did you do to make living a little easier while you were in those restrictions?
After the surgery,
Yes.
I had like, so one of my really good friends who stuck with me during that, she is an occupational therapist.
Mm.
So she got me equipped with like one of those claws that reaches down, and an extra long pooper scooper for the litter box. So it
Nice.
was all set to go for that kind of stuff. Um, I was really good at not like, of like not lifting things, and
Okay.
like just like not carrying too much. I learned how to, like, I still got close to the floor, but I squatted
Squat it. Yeah.
so I wouldn't. Yeah. So I mean, I still do that. I'm not ever bending like a normal person again, because so I got I got through it pretty good, and like I recovered well and quickly
Okay.
from the surgery itself.
Hmm. You said it
So
took you about 8 weeks to be pain free.
it took me about 8 weeks to be pain free.
Okay.
And so there was a period there where I was again like losing my mind,
Hmm.
because and I went back at one point to the pain doctor that I was seeing, and he refused to give me the injection because I had the surgery.
Yeah.
And I lost my mind,
Mm.
like lost it. I ended up leaving, and like, oh, I don't even want to think about that day. That was a bad one, but
Mm.
um I really like like I felt hopeless and helpless
Yeah.
because I thought that I needed that injection. He wouldn't give it to me.
Okay.
And I didn't realize that I was at the end of this waiting game where the pain was going to disappear. I thought
Right.
the surgery didn't work.
Yeah.
So, but from the surgery itself, even like before the pain went away, like I was healing really well, like with the incision and stuff, that all healed really well.
So many people go into the surgery not realizing that like the 2-week mark and then the 4 to 6 week mark is going to be a pain flare. And I'm sure the large majority of us think our surgery failed.
Yeah. And I see so many people on the forums that will say stuff like, I just had my surgery like 2 days ago and I'm in pain. I'm like, yes, you are. And you probably will be for another 2 months, but don't let that take away your hope, because I haven't had pain now since, like January of 2020, January 2020. Yeah.
Did you do physical therapy after surgery?
I didn't. And I know people are recommended to do it, but I've always been really lazy with physio. Like I've needed physio like a bunch of times. I did go to physio prior to surgery.
Yeah.
I didn't go after, and I don't really have a good excuse for that.
Yeah.
But I didn't go.
I'm one of those people that as soon as I hit my goal with something, I stop doing it.
Yeah.
So I did physical therapy for the prescribed amount of weeks post-surgery, and then felt better. So I stopped doing the physical therapy. Hi, Tiberius. Hi.
Oh, he's cute.
This is Tiberius. Oh, he's one of my 2 beagles that pulled me backwards and made me get back surgery.
Uh-oh. But he's beautiful.
Thank you. So I did the physical therapy like I was supposed to, and then I stopped doing it. And then maybe a year later after the surgery, I noticed my hip muscles would start killing me when I would go on walks, when I would walk the dog. And so I put myself back into physical therapy. And it turns out that I had just, in my mind, gone back to guarding and not moving my body like I was supposed to be. And your muscles get weak. Yeah. So I was real thankful for physical therapy, but I'm lazy too.
Oh, that's really interesting. And I definitely, I definitely don't recommend that people take the route that I took, like without doing physiotherapy. Like I really do think it benefits so many people. Like, it's funny in a not so funny way, but I became so much more active after that. I feel like I was able to strengthen my body and just doing like so much more. I've done more activity in the past 5 years than I've done in the 35 that preceded it.
Like what?
So like I had a period because like I mentioned, I had some mental health issues. I had a period of like 10 years where I didn't leave the house. And that went from like age 18 to 28. And so I basically did nothing during that time but sit at home on the internet. Even before that, when I was a kid, like I was scared of my own shadow there. I didn't do anything. But since then, I've started the kayaking. I only just started doing that a couple of years ago, and I love it. I've started doing these hikes that I was scared of bugs so much that I would not go out in the woods. And somehow I'm not, like, I still get like sometimes, but I'm not that scared of them anymore. So I'll go out and hike. And like, there was one hill that I scaled down and had to pull myself up with a rope. And I was like, I couldn't have done that. There's no way I would have done that like 6 years ago.
That's great. I'm a camper. I love hiking and camping. My husband and I will canoe when we get the chance. We don't get to do it as much as we'd like. But that's one of the things I say on my video, like, you'll get back to doing your stuff. Like, you'll get back to camping, I swear.
Yes. Life comes back. And that's the good thing about surgery. And that's why when people say like, oh, I'm so scared of surgery, I'm like, it was the best decision I ever made. And it's not for everybody, but if you've got no other way to get rid of the pain, it might be for you. And my life is a million times better since I've done it. Life comes back.
Yeah. Do you still get sciatic flares?
I don't. No.
None.
Nope, never. I had one bout about 2 months ago where I started feeling this thing in the back of my leg, and I thought maybe it was maybe like I was sitting too much with my books, like, I was
Yes.
reading too much.
Uh-huh.
And it went away. So I don't know what it was, but it went away. I don't think it was sciatica, and I haven't had any flare-ups since that 8 weeks after the surgery.
That's great.
Mm-hmm.
So I have a Reddit community called Microdiscectomy. I'm also in the Facebook Microdiscectomy community. So people will watch the podcast, but oftentimes I'm talking to people who just had it done like 8 months ago, and they keep asking me, we need long-term success stories. So you would be considered an amazing long-term success story.
I am so glad. And I never thought this day would come. And that's why I stay on the group, because sometimes like I'm on the group and I'm like, do I really need to be here anymore? I'm not suffering. But then I remember there's so many people out there that are suffering. And if I can give them a tiny bit of hope that I didn't have back then.
Right, exactly.
That's a good reason for me to stay on the group.
I get so many personal messages. I do the Reddit, and I do TikToks, which is difficult. I don't do any TikTok dances, but I'll do videos on there. Tons of personal messages of people saying, did I ruin my surgery? Is this normal? I'm like, yeah, you'll get pelvic pain, all kinds of weird stuff. Yeah. So is there anything that you would love to impart to someone who may be about to get surgery or thinking about surgery that you think they should know?
Like, I'm just to do it, go through it, because it saved my life. And if you're in that much pain, don't let the statistics scare you off, because 20% chance is a lot smaller than the 80% chance that it is going to work.
Right.
And people are scared of that 20%, the 5 and the 15, 5% that you're going to be worse, and 15 that it's going to do nothing. Well, don't let those statistics scare you off, because it is so, so worth it. I wouldn't have a life right now if it wasn't for surgery.
Right. And have you found any mental health resources since the surgery that you think would be helpful?
Well, it's interesting. This isn't really a solution for anybody else, but I got my mental health help when I moved to New Brunswick. And it's funny that the people in New Brunswick say that their mental health system sucks. But when I compare it to what I was given my whole life here, it was so much better. So I'm still seen by doctors in New Brunswick for that reason. They haven't let me go. Awesome. And so there's not really much I can say. I've just been very blessed during that time period that I spent in New Brunswick.
That's great. Susan, I really appreciate you taking the time out of your schedule to share your story with us. I know it's going to be very beneficial for a lot of people to listen and see, yes, there are long-term success stories.
Well, thank you so much for having me here. I'm very honored that you asked me to come. And if my story can help anybody out there, it's a blessing to me. It really is.
Definitely. And if you are a listener and you have a positive story of recovery that you would like to share, head to my website, bedbackbeyond.com, and click share your story. I'd love to include your voice on the show. Susan, once again, thank you so much.
Thank you.